right, so I wanted to get into a little bit of what these dogs look like. Once you've seen one, you'll never forget it. A very common presentation reported in shelters is finding apparently healthy dogs dead in their kennel one morning. And there's a lot of blood that is oozing from their nose and their mouth. As shown, these are two dogs that actually were found dead in their run during the Miami 2008 strep zoo outbreak. It's a very frightening sight to see this. I mean, you think the first thing that comes to your mind when you walk in the run and see all this blood, this dog's head and all this pool of blood, is Ebola virus. Of course, that's not what it is. But has anyone seen this? Has anyone? Okay. Sorry about that. I hope you don't have to see this. It's frightening. Other dogs can have a history of kennel cough for a couple of days. Noted by the text. Nothing done yet. But very shortly after onset of cough and nasal discharge, there's a rapid progression to respiratory distress, nasal hemorrhage, and then usually death within 24 hours. It is very similar to streptococcal toxic shock syndrome in humans, which you may have heard about. This toxic shock syndrome in humans is also caused by strep bacteria, but it's strep pyogenes. So this is sort of a toxic shock syndrome that we're seeing in these dogs infected with strep. So did you want to play one of the, these are videos taken by Dr. Brian DeGangi of dogs that were infected with strep. So what you need to notice here, look at the dog's mouth as it's struggling to breathe. That's respiratory distress. This Dr. DeGangi went back later in the day, I think, and found the dog laying cross-state on the floor of its run, would not get up with encouragement, and breathing just like this. Have you ever seen a dog breathe like that? If you have, it's bad news for that dog. We have another presentation. Look at the hemorrhage on this bulldog's nose. Look at the snot coming out of that companion's nose. But what I want you to notice is on the white muzzle of the dog on the right, there's a lot of nasal hemorrhage. It's covering its muzzle. Look at how it's struggling to breathe, getting some comfort from its kennel mate. But see those ribs working? This dog died later that night in its kennel. And it had strep zoo. Thank you. So those are the two more common clinical syndromes that you will see with strep zoo. It does cause a very fibrinous, suppurative, necrotizing hemorrhagic pneumonia. In the picture on the left, this is the open thoracic cavity of a dog that died from strep zoo pneumonia. I hope you can appreciate the pool of free blood inside the thorax. Here's a lung, here's a heart. But what you will see are lungs that look like this, very meaty looking, they're full of hemorrhage. They don't float because they have no air in them. And then the free blood in the chest cavity. To give you a little picture of what the actual lung tissue itself looks like at the microscopic level, this panel on the left is a normal lung. The tissue is the purple those purple strands, and notice all the free space on that slide. That's for air exchange. Lots of area to exchange oxygen here. This is what a similar area looks like in the lung of a dog with strep zoe. Do you see the open airways? In here you may see, what, 2 or 3? But everything else is consolidated, filled up, clogged up with inflammatory cells, the little purple dots, and hemorrhage, represented by the red blood cells here. So there's no wonder these dogs are breathing with a grimacing expression and having blood come up from the respiratory tract and really heaving and working with their rib cage to breathe. They can't get any oxygen through a lung that looks like this. And you can actually see the little chains of gram-positive cocci embedded into the lung tissue as a part of the confirmation of cause of death.